Hello everyone, am I audible and visible to you? Okay, so myself, Dr. Sheetal Pipalia, welcome with Practicable. Today I am going to discuss about megaloblastic anemia. Okay, laboratory investigations related to megaloblastic anemia. Now let us see the investigations. See, first important thing which you must know is megaloblastic anemia किस चीज की वजह से होता है? It is because of vitamin B12 deficiency or it can happen because of folic acid deficiency. Now, vitamin B12 deficiency can be itself a dietary deficiency or increase in demand or something like that, or it can be because of the deficiency of intrinsic factor. इंट्रिंसिक फैक्टर की डेफिशिएंसी की वजह से भी विटामिन B12 डेफिशिएंसी हो सकती है. ओके, सो बोथ ऑफ दिस आइदर विटामिन B12 डेफिशिएंसी या फोलिक एसिड डेफिशिएंसी कोई भी हो, बट इट विल कॉज मेगालोब्लास्टिक अनीमिया. मेगालोब्लास्टिक अनीमिया जो है इट इज अ मैक्रोसाइटिक अनीमिया. मैक्रोसाइटिक अनीमिया होता है. ओके, इन दिस इफ यू लुक एट द इन्वेस्टिगेशन, सी द इन्वेस्टिगेशंस. सेल काउंटिंग क्या है? आरबीसी काउंट, डब्ल्यूबीसी काउंट, प्लेटलेट काउंट, ये सारे जो काउंट है इट विल डिक्रीज. ओके, वी विल डिस्कस दिस. देन hemoglobin content reduces. Blood indices like mean corpuscular volume, mean corpuscular hemoglobin, all this will increase, right? It is a macrocytic normochromic anemia, right? Then peripheral smear. Peripheral smear will show presence of nucleated RBCs with marked anisocytosis and poikilocytosis. Means there will be change in the size and shape of the RBCs. Rather than forming normoblast by bone marrow, there will be formation of megaloblast, right? So it will show nucleated RBCs in the peripheral smear with marked change in size and shape, right? Then serum bilirubin level, it will increase. Serum iron level will increase. Plasma concentration of vitamin B12 decreases and serum folate level decreases. Now let us understand this. See, this is the picture of megaloblastic anemia. This is how peripheral smear will look like. Okay, see this one. This is megaloblast. Okay, this is macrocytic normochromic anemia. Macrocytic normochromic anemia. So see here, HB level overall, HB level percentage decreases. RBCs are increased in the size. That is because of the formation of megaloblast. Okay, megaloblast. Rather than forming normal sized RBCs, it will form larger size RBC. The reason behind that is defective. There is defective DNA synthesis. Okay, because of defective DNA synthesis, there is a maturation arrest. Okay, there is a maturation arrest. So rather than forming normoblast, it will form larger size cell, nucleated RBC, that is megaloblast. Now this megaloblast will appear in the सर्क्यूलेशन, ये सर्क्यूलेशन में अपियर हो जाएगा. ओके, नाउ बिकॉज ऑफ दिस, क्योंकि मेगालोब्लास्ट फॉर्म हो रहा है और सेल साइज बड़ी है, सो इट कॉजेस इंक्रीज इन एमसीवी. एमसीवी मीन्स मीन कॉर्पस्क्यूलर वॉल्यूम. इट मीन्स मीन कॉर्पस्क्यूलर वॉल्यूम. ओके, मीन वॉल्यूम की बात हो रही है. सो इट विल इंक्रीज. MCH, mean corpuscular hemoglobin, that will also increase. Now why MCH increases? The reason behind increase in MCH that as RBC count reduces, क्योंकि RBC count जो है total RBC count वो जो है वो कम हो रहा है. Okay, so mean corpuscular hemoglobin relatively it will increase. Okay, this value will increase. MCH and MCHC will be normal because MCV and MCH both are raised. Okay, so MCHC will be normal. Now, because of the formation of the megaloblast, there will be excessive destruction of the RBCs, right? तो excessive destruction of the RBC मतलब कि hemoglobin release जो है वो ज्यादा होगा. अगर hemoglobin release is more, then it means that catabolism of hemoglobin will be more. So one of the end product of hemoglobin catabolism is bilirubin, right? So it means that it will cause increase in the serum bilirubin level. Serum bilirubin level will be raised. If serum bilirubin level is raised, in that case, what will happen here? It will give you a picture of hemolytic jaundice. Okay, hemolytic, or you can say prehepatic. Hemolytic or prehepatic jaundice. Because of excessive destruction of hemoglobin, excessive catabolism of hemoglobin, iron is released, right? So serum iron level will be raised. Okay, serum iron level जो है वो ज्यादा होगा, right? Excessive destruction of the RBCs are there. So this is the anemia. ये anemia है जो कि जॉन्डिस के साथ associated है. This is very 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 important. Okay, RBCs are larger in size, तो megaloblast form हो रहा है. Megaloblast formation is there. That's why there is excessive destruction of RBCs. Excessive destruction of the RBC means there will be decrease in the total RBC count. So it will cause anemia. Because it is associated with hemolysis, right? So there will be increase in the serum bilirubin level also. So this is a type of anemia which is associated with jaundice. Okay, there is a pallor. Okay, and there is also yellowish discoloration of the skin and mucous membrane. Okay, so it causes increase in the serum iron level and increase in the urine urobilinogen level. Okay, increase in the urine urobilinogen excretion. Okay, as I told you, WBC count and platelet count both will decreases. Why? The reason behind that is megaloblastic tissue will occupy the space in the bone marrow. So relatively it affect WBC and platelet count formation. Same time, vitamin B12 is also needed, okay, for the WBC and platelet formation in the bone marrow. So it causes decrease in the WBC and platelet count. Serum folate level will also reduce. Why so? Because vitamin B12, decrease in the vitamin B12. Whenever megaloblastic anemia is due to vitamin B12 deficiency, it also affect folic acid metabolism. Folic acid metabolism को भी affect करता है. Okay, it will cause metabolic blockage of folic acid metabolism because at some step vitamin B12 is needed. Okay, so if vitamin B12 is not there, then folic acid metabolism is also affected. So serum folate level reduces. So whenever megaloblastic anemia is because of vitamin B12 deficiency, there should be supplement of folic acid too, right? Because of vitamin B12 deficiency, folic acid deficiency B hogi. Okay, so it should be treated by both vitamin B12 as well as folic acid. Then if you examine bone marrow, it will show megaloblastic hyperplasia. It shows megaloblastic hyperplasia. Means here 70% are pro-erythroblast and early normoblast and 30% are intermediate and late normoblast. This is megaloblastic hyperplasia. Okay, so this is important. These all are important findings. Okay, if you want to clinically differentiate, अगर हम clinically differentiate करना चाहें vitamin B12 and folic acid deficiency anemia को, here vitamin B12 deficiency anemia clinical picture, here there will be involvement of neurons. Okay, इसमें neurons जो हैं वो involved होंगे. In folic acid deficiency anemia, neuronal symptoms will not be there. Okay, because vitamin B12 deficiency will cause subacute, it will cause subacute combined degeneration of spinal cord. Okay, ये सब acute combined degeneration of spinal cord करेगा. That's why there will be tingling and numbness of hand and feet. That is associated with vitamin B12 deficiency. अगर clinically you find all the pictures or all the features of megaloblastic anemia, अगर आपको lab investigation में दिख रहा है कि ये megaloblastic anemia है, and now you are supposed to differentiate it clinically कि भाई vitamin B12 deficiency की वजह से है या folic acid deficiency की वजह से है. In that case, if neurons are involved, अगर neuronal involvement है, once neurons are involved, it means it is a vitamin B12 deficiency. अगर neuronal involvement नहीं है and still there is a picture of megaloblastic anemia, means it is a folic acid deficiency anemia. So this is all about lab investigation. So very quickly you can correlate this everything with the investigation list which I have provided. राइट कि सेल काउंटिंग, टोटल आरबीसी काउंट, डब्ल्यूबीसी काउंट, प्लेटलेट काउंट सब रिड्यूस होंगे, हीमोग्लोबिन कंटेंट भी रिड्यूस होगा. मैक्रोसाइटिक नॉर्मोक्रोमिक अनीमिया है तो ब्लड इंडाइसिस में एमसीवी एमसीएच विल बी रेज्ड. पेरिफेरल स्मीयर विल शो मेगालोब्लास्ट, न्यूक्लिएटेड आरबीसीज. न्यू मेगालोब्लास्ट फॉर्म होगा तो आरबीसी डिस्ट्रक्शन ज्यादा होगा, राइट. तो इट विल गिव यू अ पिक्चर ऑफ हीमोलाइटिक जॉन्डिस. तो सीरम बिलिरुबिन लेवल ज्यादा होगा क्योंकि एक्सेसिव हीमोग्लोबिन कैटाबोलिज्म हो रहा है. So there will be increase in the serum iron level. Plasma level of vitamin B12 will be reduced. Vitamin B12 is also needed for folic acid metabolism. तो vitamin B12 की deficiency होगी तो serum folate level will also be reduced. Bone marrow examination will show this megaloblastic hyperplasia. Okay, so this is all about. Hello, Elon. Thank you so much, Lakshmi. Thank you, Dr. Dipti. So this is all about today's class about megaloblastic anemia. Stay tuned for the study with the practicable. Here we are going to cover various practical aspects related to the medical field. Okay, so stay tuned for the study with practicable. Thank you so much. If you have any question, you can please ask. Okay, so this is all about laboratory investigations, and now you can easily understand that always remember that megaloblastic anemia is a type of anemia which is associated with prehepatic jaundice. Okay, this is very important to remember. Please go through the table which I provided in the first slide. Okay, thank you so much all of you. Please stay tuned for the study with practicable. Thank you.